The RAISN trial is a trial where we're investigating a new approach for patients with a newly diagnosed testicular cancer in a clinical stage 1. That means that patients that don't show any metastasis in the initial staging. And we are investigating the sensitivity and effectiveness of the sentinel lymph node biopsy in these patients. And this is a very novel approach that has been only sparsely investigated before, and we think this had a great potential for these patients. In this trial, we enroll patients and they undergo a simultaneous orchiectomy and a laparoscopic ICG-guided sentinel lymph node biopsy in the same procedure, and we perform a frozen section examination of the sentinel lymph node biopsy. And if the sentinel lymph node biopsy is positive for a malignant tumor, we perform an immediate robotic-assisted template RPLD. And the potential of this approach is that recurrences will be detected before they even occur. So we can prevent the recurrence, treated immediately. And so the patients won't need, we will reduce the need of systemic therapies. Also, if the sentinel is negative, there's also potential to improve the current management because the patients won't need an adjuvant chemotherapy and they could be enrolled in less intensive surveillance protocols. And thus reducing also the psychological burden of this of these patients. And the preliminary results for right now are that we have recruited 19 patients of 27 planned, and the sentinel lymph node detection was possible in all patients using ICG, and the time from ICG injection to the sentinel marking was between 10 and 2 minutes, and all patients could be discharged on the day after surgery. So far, we have had one patient who had a positive sentinel who received a robotic RPLD, and 18 patients who had a negative sentinel lymph node biopsy in the frozen section. And in the final histopathology reports, we had one patient had a mixed tumor. He had a seminoma and embryonal carcinoma in the final sentinel lymph node, and 18 patients who had tumor-free lymph nodes in the final report. In the testicle, we had 13 patients with pure seminomas, one patient with a spermatocytic seminoma, and 5 patients with non-seminoma or mixed tumor. And we haven't observed any recurrences so far, and we plan to finish recruitment by the results of the trial in 2027, when all patients have undergone a 2 years follow-up. Thank you very much.